Academy of Country Music. Director Chief William Swan of the Office of Emergency Management and Nashville Fire Department, and Dr. Michael Caldwell, Director of the Metro Public Health Department, are here with us to help answer your questions. We will now begin with Mayor John Cooper.
Good morning, Nashville. Now, this weekend saw widespread compliance with the Safer at Home order, as combined Metro Health and police enforcement teams continued their patrols and investigations throughout Davidson County. Now, we also saw 2 days of increased case numbers, which Dr. Alex Shahanger will address momentarily. Fatalities and hospitalizations, however, have remained stable. We are carefully monitoring all public health benchmarks required to begin Phase 1 for the roadmap for reopening Nashville, and will report on these criteria daily. I urge everyone to continue following the Safer at Home order as we work together to safely restart our economy. Now, as a reminder, the benchmarks for the first phase of our plan include an acceptably stable or sustained decline in new COVID-19 cases over a 14-day period, adequate testing and PPE supplies for our region, low transmission rates, and an increase in our capacity to conduct contact tracing throughout Davidson County. Now, this morning, I want to welcome Metro Councilman at Large Steve Glover, who has joined us this morning as co-chair of the Metro Small Business Task Force, to discuss how the task force is assisting local small business owners to be prepared for business in the COVID era. I want to welcome also Ralph Schultz, President and CEO of the Nashville Area Chamber of Commerce, who's been a valuable voice as we've created the framework for our community's economic reopening. Ralph is here to discuss his ongoing conversations with employers throughout our community about the roadmap for reopening Nashville and what businesses are doing to ensure the safety and well-being of both their employees and customers. It's also my pleasure to welcome Damon Whiteside, CEO of the Academy of Country Music, who's here today with a very special announcement for Nashvillians and country music fans worldwide. As I've said before, the coronavirus outbreak came quickly, and our community's response has been swift. But learning to safely live and work with the virus until we can return to 100% business as usual will take considerable effort and time. As we continue to gather and analyze COVID-19 data, we will maintain a dialogue with all of you, including Nashville's business owners, faith leaders, hospitality employees, frontline healthcare workers, and working families from across the city. Remember to visit covid19.nashville.com to view the roadmap for reopening Nashville, and remember, we want to hear from you. Your feedback is important in helping us understand how our plan can best serve Nashvillians and may further inform the framework that is in place. In the meantime, let's continue working together to flatten the curve of the coronavirus so we can get Nashvillians back to work as soon as it is safely possible. As a reminder, community assessment centers are open today, Wednesday and Friday, from 9 a.m. until 3 p.m. If you believe you may have symptoms of COVID-19, call the Metro COVID-19 hotline at 615-862-7777, anytime between 7 a.m. and 7 p.m., 7 days a week. All services through the community assessment system, including the COVID-19 tests, are free to all Nashville residents. As always, I urge you to visit Metro's COVID-19 website and consider donating, as you are able, to the COVID-19 Response Fund by visiting covid19.nashville.gov. And you can also visit the website to learn how to obtain direct financial, food, mental health, and social service assistance. And now I'll turn it over to Dr. Alex Shahanger, Chair of the Metro Coronavirus Task Force.
Thank you, Mayor Cooper, and good morning, Nashville. Here's the latest on the coronavirus in Davidson County. We have 2,488 confirmed cases with a total of 22 fatalities. That is an increase of 312 cases since our last update Friday morning. There are an additional 2,111 cases in the surrounding counties, bringing the total for our region to close to 4,600. Of the Davidson County cases, 1,265 are currently active cases, and 1,201 residents have recovered from the virus and have been cleared. The number of new cases over the weekend did increase by larger amounts than last Wednesday and Thursday, and this increase in new cases over the weekend negatively impacts our 14-day trend. In fact, the 14-day trend of new cases has gone from remaining flat to slightly increasing. Friday afternoon, Vanderbilt released their latest update and modeling. The transmission rate for our region continues to be just under 1, meaning that, on average, a person with the virus is transmitting it to just one or less other individuals. This metric remains in the satisfactory range for the reopening. In addition, the other metrics also in the satisfactory range include contact tracing resources, testing capacity, PPE supply, and hospital capacity. Now, this is encouraging news. However, one must be aware that as this week progresses, hospitals will begin to perform more procedures and more of our surrounding communities will begin to open up businesses. This can impact our metrics, and this is one reason we will closely monitor these. We are also hoping for an early May start to phase 1 of reopening. However, we are not ready to set a date this morning. Last week, Mayor Cooper, Today, our community assessment centers are open until 3 p.m. They are located at Nissan Stadium, Meharry Medical College, and at the old Kmart in Antioch. You can drive up or walk up and be screened by a medical professional and receive a test. And all of this is at no charge to you. Since opening up just last month, we have tested over 5,000 Nashvillians. Last week alone, we tested over 2,700 residents. Our assessment hotline is also open today and every day from 7 a.m. to 7 p.m. Medical professionals are standing by to answer your questions about the virus and direct you to resources if you need them. Since opening last month, more than 7,000 people have called our hotline. If you feel that you may have COVID-19, have been in contact with someone who has tested positive, or you're just worried about the virus, please reach out to our hotline, contact your healthcare providers, or go to one of our assessment centers. Please continue what you are doing, Nashville. Stay at home, especially if you are sick. If you must go out, limit trips, practice social distancing, wear face coverings, and return home right away. Every day we do this is another day we get closer to coming back to normal. Thank you again for all you are doing for this to battle this virus. Remember, we're all in this together, and we'll get through this together. I now would like to introduce Councilman Steve Glover. Thank you.
Thank you, Doctor. Also, thank you, Mayor Cooper. This morning, I wanted to come and speak to the small business community very briefly, just to let you know what the Small Business Task Force has been involved with. Myself, along with Christina Allen, have been co-chairing this for about the last month and developing plans in order to help the small business community determine how do we reopen in Nashville. We're coordinating our efforts with the mayor's office, and we've created a website for you, quite frankly, as a resource, sbtfnashville.com. You can go on. We'll talk about the financial resources that will be there. We talk about the financial resources from the state that may be available and from grants and private individuals. We're also working with the Metro Health Department in the coming days to try and develop a systematic plan for how we help you and the employees train, get ready for how you reopen, and hopefully determine a date. Now, we'll be providing you the number once that line is provided and we're able to communicate with you more clearly and give you dates, hopefully, and where we'll be heading from there. But with that, we will continue to coordinate with the mayor's office in order to get our business back in business as quickly as we can in Davidson County. With that, I'll also introduce now, if I may, Mr. Ralph Schultz from the Chamber.
Thank you, Councilman, and thanks to Mayor Cooper for engaging us in this whole process of reopening the economy in Nashville. Last week, Mayor Cooper published his plan to reopen the economy in Nashville based on data and not dates. We've heard from many businesses who support that plan as we support it at the Chamber. Last week, to support the data-driven strategy, the Chamber's Research Center provided an economic impact model to state and local officials. That information is also available to you at NashvilleChamber.com. As a business owner, it will support your planning by projecting our economic environment over the next 20 months. Also, starting today, later today, the Chamber will provide additional reopening support to all businesses. The Chamber is creating a clearinghouse of information on how different business types can safely reopen to protect their employees and their customers. The information will be drawn from relevant trade organizations and regulatory groups. Restaurants and retail will be added by the end of today, and new business types will be added throughout the rest of the week. Also, in May and June, the Chamber will host a webinar series, Your Partners for the Next Normal, open at no cost to all Davidson County businesses on topics related to reopening, from industry best practices to ensuring employee and customer safety. Visit our NashvilleChamber.com site for help and information on both initiatives as your business navigates the path to reopening. We are pleased to be continuing to work with the mayor on this important project. So thank you, and now I would like to introduce Damon Whiteside, who is the CEO of the Academy of Country Music, to bring you up to date from the Academy of Country Music. Damon?
Thank you, Ralph, and thank you, Mayor Cooper. I appreciate being invited here today, and I hope this will bring some positive news to Nashville and the country music industry that calls Nashville home. As you may know, the Academy of Country Music was forced to postpone our 55th annual ACM Awards ceremony that was planned to take place in Las Vegas earlier this month to this September. Due to concert tours, sports, and live events postponing their spring and summer events to this fall, we searched the country to find another location in the best city and venue to safely and effectively move our show. I am happy to announce this morning that we have chosen Nashville to be that location. Being in Music City allows us to honor the rich legacy of country music, and I am proud to also announce that our show will take place from three of Nashville's most historic and revered venues, the Grand Ole Opry House, the Ryman Auditorium, Mother Church of Country Music, and the Bluebird Cafe. We could not be more honored that our 55th Academy of Country Music Awards will broadcast live on CBS Wednesday, September 16th at 8/7 Central with these iconic venues and the city of Nashville as our centerpiece. This is the first time in Academy history that our show has taken place in Nashville, and being that this may be the first live award show on broadcast television since the pandemic, we are proud to shine a national spotlight on this great city and these beloved venues. A decision on our ability to have an audience will come at a later date based on city's health and science data. A huge thank you to Governor Lee, Mayor Cooper, Butch Spiriton and the Nashville Convention and Visitors Corporation, Colin Reed, Scott Bailey and the entire Opry Entertainment Group, and Erica Wallem-Nichols and the Bluebird Cafe team for all of the tremendous support in helping us make this move possible. I also want to acknowledge our partners at CBS and Dick Clark Productions for helping the Academy to be nimble during these challenging times. Now let's take a look at a quick video glimpse of the ACM Awards.
Thank you so much. God bless every one of you. Well, we are all winners tonight. Thank you so much.
You guys have changed my life forever.
The Academy of Country Music is first and foremost a trade organization dedicated to serving the country music community. As with many industries, our music community has suffered tremendous hardships and thousands of individuals have lost their financial stability. However, in the spirit of Nashville and country music, our industry and this city are incredibly giving and always ready to lend a helping hand. Through our ACM Awards, the Academy is able to raise funds to support our charitable arm, ACM Lifting Lives, which is dedicated to improving lives through the power of music. I am incredibly proud to announce today that to date, our ACM Lifting Lives COVID-19 Response Fund has distributed $1.4 million in emergency relief funds directly to hundreds of country music professionals, the ones behind the scenes making our country music industry so bright. This includes musicians, songwriters, touring personnel, developing artists, and many more whose income has been drastically reduced or eliminated. A majority of these funds went directly to your neighbors and friends in the Nashville community. The ACM Lifting Lives COVID Fund has been funded through the Academy of Country Music, individual donors, and corporate partners such as Amazon and AT&T. As we hope to continue helping our industry in need through this quarantine, we encourage you to get involved with this powerful initiative by visiting acmliftinglives.org. Thank you, and we look forward to our partnership with the City of Nashville.
Thank you, Mr. Whiteside. We will now start the Q&A segment of today's briefing. As I announce your name, you may proceed by asking your question over the air. We'll start with Brett Kelman from the Tennessean. Welcome back, Brett.
Hey, good morning, everyone. Good to be back. So Dr. Nehanger said that the city is hopeful for an early May reopening, but we have seen several days of increasing cases, which seems like it must reset the 14-day stability metric back to ground zero. Doesn't that mean, based on your own reopening plan, that we are at least 14 days away from phase one as of right now?
Thanks, Brett. Dr. Jahangir.
Thank you, and Brett, welcome back as well. So in short, as I've said last week, we're not just looking at one metric. There's multiple metrics we're evaluating. Specifically around the 14-day one, it is a rolling average, and so not necessarily one spike or two spikes in days doesn't necessarily reset the whole clock. Okay, so multiple metrics we're looking at, and the 14-day one specifically is a rolling average that is impacted by days before and subsequent days after. So thanks.
Julia Palazzo at WKRN.
Good morning. Thank you so much. Dr. Jahangir, going back to the 14-day trend, since you said it's increasing the new cases. So if every other metric looks good, but that trend continues to increase and not look as great or isn't satisfactory, is that enough to stop the reopening? Also, do you have the number of people that are currently hospitalized? I don't think I heard you mention that. And then just a quick question for Steve. What concerns, if any, are you hearing from business owners about the timetable of reopening? Thank you.
Councilman Glover had to leave us for a prior engagement, but I will follow up with you, Julia. Dr. Jahangir?
So thank you, Julia. Regarding the 14-day trend, one other metric that we're looking at strongly is the transmission rate. The transmission rate is, as I mentioned, the rate that one person infects another individual. So the Vanderbilt model, which was released I think a couple of weeks ago, had it below 0.9, or had it at 0.9. The one that was released Friday kept it at 0.9. And I'm actually having a conversation with those individuals later today to see how far back does it go at 0.9. The 14-day trend will influence the transmission rate. As long as the transmission rate is below 1, we're at a good place. And so, again, as I've said before, there's multiple metrics we're going to look at. Rolling day 14 trend is one of them, but transmission rate is a really important one. If you remember last weekend, we were actually high as well, and then as the week went on, the numbers lowered, and so the average remained flat. And so just take that for what it is. Regarding hospitalizations, you're right. I didn't say that. I can tell you, looking at hospital capacity today, we are at 39% available of all regional beds, and 32% of ICU beds are open today. The number of people who have COVID in our hospitals, again, based on my morning conversations I have with the other hospital systems, still remains around that 50 to 60 range of individuals, of which a percentage of those are hospitalized or ICU-wise, and I apologize, I don't have that number off the top of my head. And about 144 Nashvillians since the beginning of this entire virus have been hospitalized in our hospitals. So that's what the data I can give you around hospitalizations today. Thank you.
Tosin Fakile at WSMV.
Good morning, Chris. Good morning, everyone. Thanks for taking our questions. My first is for Dr. Jahangir. I know you guys don't want to set a date, but would it be easier to just either extend the safer at home order much longer, or just pick a date, and then if your metrics work before that date, you just open anyway? Because I've had questions of are businesses, if you just pick a date, do businesses have enough time to prepare for that opening date that you guys call if you don't set a date ahead of time? And for Mr. Schultz, is there a way you guys are going ahead with businesses before times to make sure they're accurately doing what they need to do to be prepared, and if they have everything they need for reopening? Thank you.
Thanks, Tosin. We'll start with Dr. Jahangir.
I mean, in short, everything you state sounds like it makes sense, but we are going by the data and not the date, right? So I sure wish I could say on this date we're a go. So I just can't answer that question any more directly than that. We're looking at it every day. The mayor, I know, is thinking about this daily. We talk about it many times a day, and we're following the data. And as soon as we can set a date that gives people some leadway, I mean, I don't disagree with that statement, we will do that. And I'll defer to Mr. Schultz.
Thank you for the question. Start with the fact that businesses want to reopen, but they want to reopen well. As we hear from businesses, they want to be a safe place for employees, and they want to be a safe place for customers. So right now, they're hungry for guidance on how they can make that happen with the square footage in their spaces, and with the sanitizing capabilities that they need, and the direction and guidance that they need to be able to be a safe place. So we're working with the mayor's office, working with the state, working with industry leaders to provide them with information that will allow them to comply with those safety issues. So at this point in time, we're just providing information, and businesses are starting to act on those plans.
Peter White at the Tennessee Tribune. Mr. White.
Hey, thank you, Chris. Hey, my question was for Councilman Glover. I'll check with him later. Thank you.
Okay.
I passed.
All right, thank you. Kara Hartnett at the Nashville Post.
Hi, thanks for taking questions. Have any of the new cases been traced back to the demonstrations that are happening at the Capitol?
Dr. Jahangir.
My colleague, Dr. Caldwell, is back there. I just confirmed him. He says, as of right now, no, none have been traced back to that.
Nancy Amons at WSMV.
Hi, thank you. A question for Mayor Cooper. Are you concerned about other counties opening and that spreading virus here? And for Mr. Schultz, are you afraid of competition? Are shoppers and people taking business to other counties that are open? And will they come back to Davidson County when we open?
Thank you, Nancy. Mayor Cooper.
Yes, Nancy, I am concerned about reopening protocols inadvertently creating a second wave of cases. It is going to be one of the advantages of a robust contact tracing, both in the city and in the state. I think we'll be able to determine if that has, in fact, increased the number of cases here and in the region. But Nashville is part of the region, and our health care is delivering care to people in the region. And so we do have to work together as best we can in limiting the spread and the rate of increase of the spread.
Nancy, thanks for the question. We have a regional economy here, and I think it's in everyone's best interest, and we've heard this from mayors, we've heard this from business people, everyone's best interest to coordinate and collaborate on the openings. If there are some businesses opening in certain locations, then I wouldn't say that we're really concerned about the competition. People choose to spend their money with businesses for a variety of reasons. Sometimes it's convenience, sometimes it's relationships, sometimes it's a long time vending relationship. So even if there are circumstances where some businesses are open early in the region as compared to other parts of the region, we do expect that those customers are going to return to those businesses that they have been most comfortable and have found value from in the future.
Our last question is from Damon Mitchell at WPLN. Go ahead, Damon.
Hi, Chris. Thank you for taking my question. Just wanted to follow up on the previous question as far as other counties opening up. I know Mayor Cooper mentioned that he was concerned about that. Is there a plan? Like, are you all just kind of telling people not to go to those other counties, or do you all have like a plan in place to kind of limit like some of the cases that can potentially be brought to Nashville?
Thank you, Damon. Mayor Cooper.
Well, I think there, of course, is not a plan to limit, but I think the governor would be the first to say, along with me, your obligation to socially distance does not end at the county line or at any time while we have disease in the community. It's up to you to have, and your business, to have a effective public health protocol to limit the spread of the disease. So there will be slightly different reopening protocols and rules in Middle Tennessee. We in Nashville are going to be pretty firm in making sure that we get across into the next size of the disease as we get to each phase. We all want to do that. But no one should think, and I think the governor would agree with me, that they can drive across the county line and to do dangerous things for other people. You have to continue to socially distance. Every business will require social distancing. They are going to take a pledge to protect their customers and employees everywhere. So this idea of that the virus is not present in our entire state is wrong. It is, and people's behavior is going to have to change everywhere to comply with that, and that's going to apply for our adjacent counties as it does in Nashville.
We've addressed all the media questions in the WebEx queue this morning. I'd like to thank Councilman Steve Glover, Mr. Ralph Schultz, and Mr. Damon Whiteside.
All right, everybody, you're watching the Metro News Conference for the daily coronavirus task force meeting here. I want to run through a couple of things with you. Throughout the morning, we've been talking about the increase of cases lately. On Friday, we saw an uptick. Over the weekend, we saw an uptick. This is Metro Davidson County only. They gave us a number in this meeting here, an increase of 312 cases since we spoke to you on Friday morning. Now, the question was asked here, what does this mean for reopening Nashville? Because this is one of the things they're watching for is the cases. They say the increase in cases, Holly, over the weekend is discouraging, but it still shows that the transmission rate that they're looking at primarily is still under 1, and he even gave the specific figure, which was 0.09. So by all intents and purposes, Dr. Jahanger there was saying that they're still on course for reopening, but still will not give a date.
Yeah, exactly. They are still hesitant about saying any date. They won't even say necessarily early May, even though that is the goal. But right now, he was talking about this rolling trend. So again, back to the trend that then relates to that transmission rate. So as of now, all our metrics are looking good because of that rolling trend. We're still in the okay situation. Real quickly, I wanted to mention, if folks just tuned in towards the end, what a huge announcement for Nashville and this business that's going to be coming our way, because the 55th ACM Award, the Academy of Country Music Awards, will be moved right here to Music City. This is huge for us. Also, the fact that this will be in 3 different locations. So he mentioned Grand Ole Opry, obviously the Ryman, mother of country music, and Bluebird Cafe. So unique and distinguishing for our city, Music City, USA, to be hosting this. And this, by the way, again, that date, September 16th. So this is going to be huge. What a big announcement. And for it to be coming at a time like this is something our city really needs to hear.
Yeah, that sure is true. That is great news. Absolutely. Look, everybody, we're so glad you're able to join us here. Remember, we're going to continue to have this News 4 special report every day at 9 o'clock. At 9:30, we're going to check in with the mayor as long as they have this briefing.
Absolutely. I hope you folks will join me coming up at noon. You can always find the latest online, WSMV.com, and on the News 4 app. Just search WSMV. Hope to see you at noon. Thanks for watching.
We now return to regular programming. Get more updates at WSMV.com and on the WSMV app.